Hi everybody, welcome back to my channel. This is the first in a two-part series on healing and recovery after hysterectomy. In this video, I guide you through what a hysterectomy is, plus 4 tips to help you recover quicker. I'm Alex Hill, your physical therapist for everything pelvic health. Make sure that you subscribe to my channel and turn on those notifications for more videos to help you optimize your pelvic health and recovery. A hysterectomy is the removal of all or part of the uterus or the womb. Let's go through the different types of hysterectomies. So a partial hysterectomy is where the surgeon removes the upper part of the uterus and that leaves behind the cervix. The cervix is the lower, more narrow end of the uterus that's attached to the vagina. A total hysterectomy is where the surgeon removes the entire uterus, including the cervix. And finally, a radical hysterectomy is where the surgeon removes the uterus, the cervix, and tissues on both sides of the cervix, as well as the upper part of the vagina. This is the type that's most often used to treat cancer. Hysterectomies are performed for a wide variety of reasons, with some of the more common reasons being heavy or abnormal vaginal bleeding, a uterine prolapse, which is where the uterus starts to drop down into the vaginal walls, conditions like fibroids or endometriosis, and cancer. The 4 primary ways that a hysterectomy can be performed are a vaginal hysterectomy. This is where the uterus is removed through the vagina. This is the least invasive technique, and it also has the shortest recovery time. Laparoscopic hysterectomies, which is where an instrument with a thin lighted tube and a small camera is inserted into a small incision into the abdomen, often through the belly button. The uterus is removed through small incisions in the abdomen or in the vagina. A robotic hysterectomy is a type of laparoscopic hysterectomy where the surgeon uses a tiny robotic arm and performs the surgery through small incisions in the abdomen. And then finally, an abdominal hysterectomy is where the surgeon removes the uterus through a cut in the lower abdomen. But with this procedure, it may take longer to fully recover, but its use may be necessary either because of the size of the uterus, the need to examine the surrounding tissue, or other factors. So now that we know what a hysterectomy is, let's talk about how to really optimize your recovery after that surgery is done. First and foremost, let's talk about your water and your diet. Make sure you're getting plenty of water and good nutrients with healthy eating, including lots of protein, which can help with healing. Additionally, make sure you avoid constipation because straining can cause pain and disrupt those new incisions. You can take stool softeners and gentle laxatives early on to help avoid straining, plus getting water and fiber can help as well. Always follow your surgeon's post-op protocols. Next up is doing what's called a log roll. This is going to be really helpful with getting in and out of bed with less pain. After your surgery, you want to avoid getting up out of bed like you normally do, just kind of swinging your legs out, because that can disrupt those incisions and also cause some pain. So doing a log roll will help protect those incisions and be more comfortable for you. So if you're lying on your back, you're going to bend your knees and then you're going to gently brace your abdominals and breathe out as you turn over to your side. As you turn, the key with this movement is moving your knees, hips, and shoulders all at one time. Once you're on your side, then again, you're going to gently brace your abdomen as you breathe out and push yourself up into a sitting position. When you go to lie down from a sitting position at the edge of your bed, you're going to just do the opposite. So you're going to gently brace your abdomen, breathe out as you go onto your side, bringing your knees and your ankles up with you onto the bed as you go onto your side. If you're going onto your back or need to go to the other side, you're going to have your knees bent. And again, brace your abdomen gently, breathe out as you turn your knees, your hips, and your shoulders all as one movement. So you're not having any type of rotation until you're onto your back, and then you can do that again going to the other side. The third way to optimize your healing is early exercise. So first, let's talk about walking. First, always follow your surgeon's instructions for when to start walking and how long to start walking. But in general, the earlier you start walking, the better. Before you start walking in the home, make sure there isn't anything that can trip you up like pets, rugs, or cords, and make sure that you have supportive shoes on. Start out with slow, short walks around your house, around 5 minutes at a time for that first week. And by the second week, a goal for most people is to be able to walk for about 10 minutes at a time. Listen to your body because it may take longer than you expect to get your legs back under you to be able to walk comfortably. Most people are able to walk for 30 to 60 minutes once they get closer to 4 weeks out from surgery, but be mindful of what your activity levels were before surgery. If you weren't as active before surgery, then it may take you a little bit longer to get to that point. Once you get out to 6 to 8 weeks from surgery, then you can likely start increasing the speed and the length of time that you're walking, but again, always check with your surgeon first. Complete internal healing usually takes about 3 months or 12 weeks on average, so it is important that you continue to progress your walking program gradually, especially during this time in those first 8 to 12 weeks. Besides walking, gentle stretching and mobility can also be really helpful to help start improving the mobility and the pain of those new incisions. Make sure that you click on the links in the description below with my mobility exercise routines to start working on early after surgery to help with the mobility of those scars and help with decreasing the pain. And finally, your last tip for optimal healing after a hysterectomy is starting to work on the scars, initially with desensitization, making sure that they're not as sensitive, and then working towards mobility and actually mobilizing those scars. Scar massage and mobilization involves gently moving that scar tissue to help it heal and stay mobile. Once the incision is healed and you have clearance from your surgeon, you can start to work on gentle mobilization of the scar, usually around 4 to 6 weeks. So first you're going to wash your hands and then take the pads of your fingers and you can start to do gentle circles around the incision. You're going to work all around it, start to mobilize that tissue around the scar. And then you can actually start to do gentle circles along that scar. And then you can move that scar perpendicular, so moving it up and down. And you just want very gentle, slow movements initially. I'm not giving a lot of pressure down into that incision. You just want to do just enough that you start to move that initial top couple layers of that scar tissue. As you get to 8+ weeks out from surgery and you have that clearance from your doctor, the incision is completely healed, then you can give more pressure and movement to the scar, including doing a bending movement along that scar to help with that mobility. Make sure you watch the second video in this 2-part series on healing after hysterectomy. In the second video, I guide you through exercises to help with healing, strengthening, and getting you back to what you love doing. I hope that you found this video helpful in preparing for a successful post-op experience after your hysterectomy. Please like this video and subscribe for more pelvic health videos.